Good evening, Bahamas. You're tuned into NB12 Weekend, broadcasting from Cable 12 Studios on Robinson Road. Coming up tonight, weeks into NHI registration, but how many people are actually registered for the new health scheme? The head of the Doctors Union changes his tune on NHI support, how the National Development Plan is expected to benefit the average Bahamian, claims that BEC workers are being paid even more overtime, plus we check out this week's cutest kids and pets. I'm Paige McCartney. We've got those stories and more straight ahead on NB12 Weekend. Welcome once again to NB12. It's been a little more than 2 weeks since government announced the start of national health insurance, with the first phase registration supposedly starting on January 18th this year. Prime Minister Perry Christie said in December last year that the first 3 months of NHI would consist of registration, followed by enrollment and then primary health care coverage beginning in April. In the weeks leading up to the January 1st implementation date, as uncertainty swirled about how the aggressive new scheme would be implemented, it was revealed that the National Insurance Board would spearhead the registration process. NIB started its aggressive campaign to register citizens and residents for its new Smart Card this month. But without legislation, it seems actual NHI registration has yet to begin. At least that's according to Senior Deputy Director of NIB, Cecile Bethel, who said at this stage what her team is doing is not NHI registration.
This is the NIB registration, and you know, we have to continue to stress that. Right. This is currently the NIB, National Insurance Board's registration program. Now, later on, when the NHI's legislation is passed, I'm sure there's going to be some agreement about data sharing, etc. And I imagine that at that point, then there will be agreement on how the data should be used.
And it would be at that point that those people would be, I guess, registered for NHI.
Yeah. One of the things, you know, we always say to persons, and we're not getting as many as we'd like, one of the things we always ask our registrants to do is to ensure that they provide us with an email address. What that email address does is it gives us an opportunity to provide them with a PIN number, a personal identification number. They use that PIN number to register on our registrant self-service system, because the registrant self-service system is the system that's going to be the actual portal that will allow them and sign them up for national health insurance.
According to Bethel, the registration component for NHI won't happen until there is legislation to allow the sharing of information between NIB Smart Card registrants and the NHI Secretariat. Nonetheless, she says the registration drive for the new Smart Card has been running smoothly, with just about 10,000 people having registered in the past 2 weeks or so since the campaign started.
During the 2-week period since we started the intensified registration drive, we've registered about now 10,000 persons. And of course, the majority of those, about 7,300 of those, are for New Providence itself, and I think it's about 1,000 that are in Grand Bahama, and the balance is in the Family Islands. So yes, about 10,000. Bear in mind that the card that we're talking about is the National Insurance Board's registration or identification card. Anybody who's registered with the NIB, the card provides, though, a gateway to national health insurance, because it is our understanding, of course, that this card is what's going to allow you access to the national health insurance program.
What are, go ahead. I was just curious, the names that you're carrying for the registration process now, are they being passed on to the NHI Secretariat? How is the
No, this is the NIB registration, and you know, we have to continue to stress that. Right. This is currently the NIB, National Insurance Board's registration program. Now, later on, when the NHI's legislation is passed, I'm sure there's going to be some agreement about data sharing, etc. And I imagine that at that point, then there will be agreement on how the data should be used.
And it would be at that point that those people would be, I guess, registered for NHI.
Yeah. One of the things, you know, we always say to persons, and we're not getting as many as we'd like, one of the things we always ask our registrants to do is to ensure that they provide us with an email address. What that email address does is it gives us an opportunity to provide them with a PIN number, a personal identification number. They use that PIN number to register on our registrant self-service system.
Up to the end of 2015, Bethel says some 157,000 people were already registered for the new smart card. While she didn't say whether these numbers are an indication of how many people would be registered for NHI once legislation is passed, she said the numbers give a good idea of how many people are eligible to enroll for coverage. While 2 weeks after the Bahamas Doctors Union voiced widespread concerns about national health insurance and maintained they could not support government's plans given a lack of information and consultation, the union's president says a lot of their concerns have been addressed and he's prepared to sign on to NHI. Here's Dana Smith.
Certainly, I just need to find out where the spot is. But I've been working in the hospital, you know what I'm saying, so I haven't really, but definitely it's a spirit within me to sign on. And I am a consumer, you know, so as I tell them, I want the best care, not just for me. I want it for my mother. I want it for my sisters. I want it for my children. All right. So the only thing we want is to make sure the system is something that works for us.
BDU President Dr. Charles Clark said the government hosted an NHI workshop with physicians and other stakeholders where many of their concerns were discussed and addressed. And he said he's now had a change of opinion.
A lot of questions were put forward and a lot of our concerns were addressed. In fact, to be very honest, they made significant adjustments in a lot of things. They, as to use the words of Mr. James Akoni, he said, "We heard you, and we've made some adjustments." So I think there's still some more work to do, but it appears that there's some truly meaningful engagement at this point in time.
Back in January, the BDU had said morale among doctors is low and many feel marginalized and taken advantage of. It said it had a number of concerns, including details surrounding the medical home, a lack of suitable communication, transparency, and appropriate consultation, the insufficient involvement of frontline stakeholders, and the undeniable need for infrastructure strengthening. Well, Clark said, although it's still a work in progress, a lot of those issues have been addressed.
Personally, I see my opinion has changed to a great extent on behalf of and I think that there has been some meaningful steps towards, and really what it comes down to is the government really need better PR. Some things like we were talking about is system strengthening have actually been in place. It's just that because of in-house fighting and no notification to other members of the craft, when I say craft I mean physician body, we get the impression that this was not occurring.
In the wake of the unions publicly voicing their concerns over NHI, Prime Minister Perry Christie had said there's no need for stakeholders to talk to the government from Mount Olympus, and there's no need for any aerial political bombardment. Asked about this, Clark explained that was never the union's intent.
I'm not sure what he really meant by that because we have actually made overtures and attempt to speak to maybe not him, but certainly people in the directorates and policymakers. And to be fair to them, what they have done is actually created avenues for us to actually have more meaningful engagement.
Well, with many still asking what the National Development Plan is and how it will work for Bahamians, our Giorgio Bain sat down with Chamber of Commerce President Edison Sumner to discuss just that.
With the National Development Plan under heavy refining, President of the Chamber of Commerce Edison Sumner says it's something that's way overdue.
The National Development Plan is a document that is being produced that has wide sector appeal and consultation from throughout the country, where it is a plan that is put in place. It has several pillars to talk about the economy, citizen security, etc., infrastructural development, and the rest of it. And it's really meant to be a guiding light, a document that we can all live by, that will tell us what our end game is. What do we need to do to get there, right? What are the mechanisms that need to be put in place over the next 5, 10, 15, 20, 30 years.
The Chamber of Commerce is taking a front seat in planning the initiative of the National Development Plan, especially as a pioneer for the private sector.
We have been able to also offer some ideas and suggestions on looking at things like innovation and competitiveness, ease of doing business in the country.
Sumner called the National Development Plan a national strategic plan that goes beyond politics, that he thinks is a long overdue plan.
So it was important to get the government, of course, to buy into it. It was important to get the opposition, the official opposition, and other political organizations to buy into it, so that if there happens to be a change in government, for example, or a change in the structure of government going forward, that anyone who sits in the chair of government will have an appreciation for this plan and will be guided by it.
Sumner says he and his team will continue to be heavily involved in the National Development Plan. Reporting from the Chamber of Commerce for NB12, I'm Georgie O'Bain.